Good morning, everyone. Thanks for joining us again. Wanted to provide you a bit of an update from last week related to our COVID numbers, some of the data. Today, as I discussed last week, what I'd like to do is to talk a little bit about some sensitive information. We've been working with area hospitals, our own medical examiner's office, and the state to try to pull together some demographic and data information regarding fatalities. We now, over the course now of these last 20 months, have experienced the loss of 485 of our loved ones, friends, and neighbors. I'd like to get to some of that demographic data, in particular related to the last couple of weeks of fatalities. So before I do that, though, let's talk a little bit about some of the data points. First, we talked last week about this idea that our numbers are plateauing. They are now beginning to trend downward. We're cautiously optimistic. I don't want to say it is a trend yet, although we did see a decrease of some 100 cases from our last update, so a week ago, and those numbers fluctuated a little bit throughout the last 7 days, but since a week ago, we are now down 100 active cases. So active cases now are below 700, and it's been below 700 now for the last 3 days. And again, we've been cautious. I was very hesitant before when we started to talk about trends upward, because I think you want to see, several days, more than 3 or 4, but likely as many as 7 to 10 days of any one trend. But we did spend about a week and a half, 2 weeks plateaued at just under 800 active cases. We were confident that we could say we had plateaued. We're beginning the trend, and we're beginning what we hope is a trend in downward and decline of cases. But we're now down below 600 or 700 active cases. So over the last month, from August 22nd to September 18th, the largest amount of new cases are still occurring in the 20 to 29 age group, and that's 18% of our new cases. Now, that's followed by the ages 10 to 19 and 30 to 39 age group, and that represents about 15%, each 15% respectively, of all new active cases. Now, those interviewed, remember, we through contact tracing, we begin to contact individuals. So those who answer the phone and are willing to provide some information, we hope that you will. It helps us not only obviously address your particular health concerns, but if you test positive and you share some of this data with us and answer a couple of the questions, it's what we put together in some of this demographic information. So it helps us communicate with residents what we're seeing, and also helps us make decisions. Again, of those who are self-reporting to us through these calls, 81% of new cases are among those who are either not vaccinated or at all, or only have received one of their 2 doses if they're receiving the 2-dose vaccination. That's been pretty steady. We were at about 76% earlier on. It's now 81%, and we've hovered in that 80% range really since we began sort of tracking this particular data. We're averaging now 1,973 tests per day. That's over the last 7 days. It's a rolling average. We have seen testing increase. Now that is part of some of those employers, including the state, which mandates either vaccination or testing for certain employees. And again, we all have opinions regarding this. I have my opinions regarding all of this. We want to be able to provide you some consistent information. We're at about 1,973 daily testing averaged over the last 7 days. Now we're averaging 57 new cases daily in the last 7 days, and that is a steep decline from the 88 that we reported last week. Now again, all of this points to what we believe is the beginning of a trend downward. We're hopeful that is a trend downward. And when you see some of the other supporting data points, it does point in that direction. I just don't want to say that today. Hopefully when we're back together next week, we're still in a position where we've continued at least some decline. But we're now seeing 57 new cases per day. That's down from 88 daily new cases when we last got together. Now our 7-day rolling positivity rate is also down notably, and that we are now at 3.55%. Now that's both a result of higher testing and also lower new positive cases. So remember, We don't have a transmission rate, we have a positivity rate, and we monitor that. And that positivity rate all along has been the total number of positive cases divided by the total number of tests on any given day. Now, if you can go from 1,000 to 2,000 daily tests and only 10 to 20 positive cases, the positivity rate will still drop. So that's a little bit of the algebra, the math that goes along with this. And so what we've seen, and some people were concerned, right, if you accelerate and increase testing, you might unearth new positives. That's important to know. But of course, if you do so at such a rapid rate, people were concerned that you'd see a growth in positivity. What we are seeing, because it is supported by also the growth in vaccination, that new positive cases are trending downward. Again, not there yet. We're beginning the trend of downward decline in new positive cases, and also the increase in testing is producing now a positivity rate that's below 4%, which, by the way, is what we feel comfortable with, right? Below 4, and then we continue to see a decline below ultimately 1%. That's the direction we want to be in. And so we are in a position now where we've seen again this consistent decline in positivity. We'll continue to monitor, but we are well below where we've been these last couple of weeks, now at 3.55%. Now, as I mentioned, I want to talk a little bit about the fatality data that we know. And I do want to preface this by saying, again, all of these data points are human beings. And no matter what your view is of either how we should react or not react to the virus, every one of these numbers relates to a human being, a family member, a friend, a neighbor in our community. Also, of course, based on severity, some have dealt with some significant losses. And so I just want to be sensitive about sharing this information, right? So we've recorded 485 loved ones, neighbors, friends who have lost their life to this virus. So based on the information that we've gathered from our data sources, now those data sources include the state of New York and area hospitals and our own medical examiner's office, along with long-term care facilities. These facilities don't provide us the data. They have to input some of this information to the state, and then over the course of the last few weeks, we've asked them to try to provide us some new information that we can use to share with the public and also inform our decision making. So based on the data we've received and pulled together from those data sources, of those who have passed away since the beginning of August, so since the beginning of August, of those who have lost their life to this virus, 40% of those were vaccinated. 53% of those were unvaccinated, and 7% unknown. Now, I also want to say this. I've shared this data, this vaccinated versus unvaccinated information before. I am not passing judgment on anyone. I hope that you choose, as I did, to be vaccinated, but this information is useful in both sharing whether or not we have a severe risk or concern in our community, whether or not that's the case. It informs us on some of the decisions that we ought to be making, and I do think it suggests that those who are hospitalized and succumb to the virus are likely living with other comorbidities, and more so among those who have chosen not to be vaccinated than those who have. Not a passment of judgment, but based on the data, it helps us inform decision making, right? And so of those who have passed away to this virus since the beginning of August, 40% have been vaccinated, and 53% were unvaccinated, with 70% unknown as to their status. As to their vaccination status. The average age of those unvaccinated fatalities during the same period, so of those who died since the beginning of August to this virus, the average age was 70 for those who are vaccinated. So among those deaths these last since the beginning of August, 70 was the average age of those fatalities who were vaccinated. Now, 84 years of age was the average age among those who we identified as not being vaccinated. Of the unvaccinated deaths, so of those who lost their lives and were not yet vaccinated, again, not passment of judgment, that's information I want you to know, 75% had significant comorbidities. We think this is important to understand, that 75% of those who did lose their life to this virus since August and were unvaccinated had significant comorbidities. And again, some of those comorbidities may have led them to choose not to be vaccinated. Some of those comorbidities certainly complicated fighting back and living through and being treated with this virus. While 100% of those vaccinated had significant comorbidities. So of the deaths we've seen since August, 75% of those unvaccinated had significant comorbidities, and 100% of those vaccinated had significant comorbidities. Information that we think is very, very useful to explain how we should react as a community to where we are in this response. Now, vaccinations remain the best defense against hospitalization. We know this. Now, you may have concerns regarding vaccination. You may have information that you very much want to still get. We encourage you to ask the questions you have, to confront some of the questions you may have with a healthcare professional that you trust. And I hope, as you, as I did, choose to be vaccinated. But it is your choice, and we just know that based on the demographic information, that the vaccination is proving itself to be one of the best tools we have to keep individuals out of the hospital, and certainly to protect, in most cases, from a fatality. Now, I did flip the original numbers, so let me do this one more time so everyone is very clear, and I want to be clear about it. So since August, those who passed away, those who lost their life, 40% were vaccinated, 53% were unvaccinated, 70% unknown. The average age of unvaccinated deaths during this period was 70, while the average age of vaccinated deaths during this period was 84. Of the unvaccinated deaths, 75% had significant comorbidities, while 100% of the vaccinated deaths had significant comorbidities. And wanted to make sure I got that information absolutely correct for you. Now, 29 hospitalized, so we currently are monitoring 29 individuals that are in the hospital. That is the first time we've been under 30 since mid-August, but we've been hovering and plateaued at this 35 to 40 number. In fact, I think we peaked a little bit at about 49 or 50 earlier on, but we're at 29 hospitalizations, first time under 30 since August. I wanted you to be aware of that information. Certainly, I know the human toll of this virus. I think it's important to understand what we do know about those who have succumbed to it in these last 30 to 40 days, and use that information to help us make both personal decisions and public health decisions. Now, the hospitalizations, the demographics for the last 14-day average, so this is September 5th through September 18th, we've seen 40 patients on average. 77% of those patients are partially or not fully vaccinated, doing it again. 40 patients on average. 77% of those patients are either partially or not vaccinated, whereas 23% are fully vaccinated on average of those that have been hospitalized. Now, 2% of those hospitalized are between birth and 18 years of age. 9% are between 19 and 44. 37% are between 45 and 64, and 52% are over the age of 65 years. Now, of the vaccination data, and we want to provide you a bit of an update, we are making good and steady progress. Again, I hope that you choose, as I did, to be vaccinated. It is your choice. I believe that, and I encourage you to confront whatever questions you have, get the answers that you need, and hopefully that might encourage you to choose to be vaccinated. But again, I believe it's your choice, and I hope that ultimately you can get the information that you need and you feel comfortable with, and make the decision that is in your best health as well. 76.3% of Dutchess County adults have received at least their first dose. Now, this is information that we want you to know. The highest vaccination rates are among those who are 55 years of age or greater, and that number ranges from 85 to 98%. So 85 to 98% of those 55 years of age or older have chosen to be vaccinated, while 76.3% of Dutchess County adults have chosen to be vaccinated. Now, we are hosting a series of vaccine clinics for those who may not have access otherwise. We have ongoing clinics again, this is Monday through Friday, 9 a.m. to 5 p.m. At the Family Partnership Center on 29 North Hamilton Street in the city of Poughkeepsie. We opened the JCPenney's vaccination location at the Poughkeepsie Galleria. We're offering the first and second dose along with booster shots as appropriate. All 3 vaccines are available at this site. And vaccine operation runs every other Thursday from 4 to 7 p.m. and every other Saturday from 9 to 12 p.m. Beginning on October the 2nd. And we encourage you to visit duchessny.gov or follow us on Facebook for that information. Now, our clinics are all walk-in, but we do remind you to please bring your CDC vaccine card just so we can stamp that and appropriately record that for your benefit and your purposes. And we encourage you again to visit duchessny.gov for that information. Now, as I mentioned, there are individuals who are required by employment or mandated by the state to either be tested weekly or vaccinated. Again, we all have our opinions regarding these things. I have a very strong opinion regarding it as well. We, however, want to be sure that there's access to those who simply want to go off to work and get their jobs done and have to consider this testing regimen. So in partnership with ProPhase Labs, we've opened our former vaccination centers, so those locations at the CVS in Dover and the JCPenney's in Poughkeepsie, former JCPenney's in Poughkeepsie. These testing locations are available to teachers, students, and the general public. And as I said, on Tuesdays from 3 to 7, we're open at the JCPenney location. Thursdays, 3 to 7, we're open at the CVS and former CVS in Dover. And on Saturdays, 9 a.m. to 12 p.m., we're open at the JCPenney's. And this is that lower nasal PCR test. It is free of charge. It is not that longer, more intrusive nasal swab. And we do ask, however, that you consider pre-registration, but you can simply walk in, but pre-registration is always encouraged, and you can do that at duchessny.gov. Now, as you likely know, booster shots were approved by the FDA on the 12th of August for moderately and severely immune-compromised individuals, 12 years of age and older, who received either the Pfizer or Moderna vaccine and completed their vaccination series at least 28 days ago. That's important to know. This week, the FDA expanded eligibility for the Pfizer COVID-19 vaccine to include the following groups. So this is for Pfizer only, approved by the FDA this week. Individuals 65 years of age and older, individuals 18 through 64 with a high risk of severe COVID, and individuals 18 through 64 years of age whose frequent institutional or occupational exposure to COVID puts them at a high risk of serious complications. Now, this includes healthcare workers, teachers, daycare staff, grocery workers, and those in homeless shelters or incarceration settings. So those are the FDA-approved boosters. These groups may receive a single booster dose to be administered at least 6 months after completing your first series, so 6 months after you completed the first series. And in New York State, we are still awaiting, however, CDC and state approval and guidance in order to proceed with offering booster shots to this expanded audience. So keep in mind, for the Pfizer dose, approved by the FDA, but no regulation, no guidance, no direction from the State Department of Health and CDC as of yet. So be aware of that. When that is finalized, we certainly be about the business of providing access to those who fall within those categories and choose to be vaccinated. So what happens if you got your J&J shot? Currently, there is no booster approved, even if you are immune compromised. Now, that's partly because the J&J dose came out a little bit later, so they're still assembling their body of science and the data to be presented to the FDA for consideration. And when that happens, should it happen, we'll provide you an update. Now, what if you've got your Moderna shot? So you have your Moderna shot, and you know now that the Pfizer dose is what is being approved by the FDA for booster. We will tell you you should obviously speak to a medical professional, your doctor, talk through those particular issues, but the booster shot is approved. Booster is approved if you're immune compromised for the Moderna shots. If you got the Pfizer shot and are immune compromised, you can begin to get your booster shot now. So I know it's a little bit confusing, but if you have Moderna and are immune compromised, the booster is approved, and the larger audience for the Pfizer dose, right? The Pfizer booster, we're still awaiting New York State approval for beginning to administer that to the larger body of residents, just approved this week with some guidance. So if you got your Pfizer and meet one of the other new qualifiers, be on the lookout. Keep an eye open, and as soon as New York State provides us with that additional information, we'll be here to provide it to all of you. So I hope this information, the data, was important to you, was helpful to you. It's definitely informative to us. As I said, we are hopeful that we're beginning the trend downward in cases. We did see a steady decline in active new cases. We have seen a steady decline in the new cases per day, and a decline in our positivity rate. When I say steady, last several days, so it's the beginning of what we hope is a trend, just not willing to call it that just yet until we get some more data. The fatality information we think is very important, provides us the opportunity to make some choices both individually and collectively as a community. Hope that's helpful to you as well. And this is going to be a beautiful weekend in Dutchess County. A lot of opportunities to enjoy. We hope that you might try to find some time to get out to one of the great community events. I'll tell you that I'll be visiting at least a couple, including Tivoli's Street Painting Festival. But that said, it's also an opportunity to go out and show your support for small businesses. We encourage you to do that, in particular our farmers and farm stands. This is the harvest period, if you will, for a lot of our local farmers. So please take advantage of those farm stands and local farms throughout Dutchess County. When you include farming and tourism in Dutchess, it remains the largest economic sector and a real powerhouse in Dutchess County. And of course, when you spend your dollars locally, it helps to support not only the local business, the farmer, but it keeps a lot of our neighbors employed and keeps our resources, your dollars, in our community, and gets reciprocated and multiplied by being spent in other small businesses. So with that, we hope you have a great weekend. In the meantime, stay well, be healthy, and be kind to each other.